Hi, this is Victoria Smart, and today I'm going to be applying restraints to a patient. First things first, I'm going to gather my necessary equipment and supplies. I'm going to perform my hand hygiene and introduce myself to the patient using a calm tone. Next, I'm going to verify the provider's orders and determine if I need a signed consent form. Then I'm going to identify the patient using two identifiers, asking them their full name and date of birth and matching it with their armband. Next, I'm going to explain the procedure and why the need for the restraints has been prescribed by the doctor. I'm going to consult the physician if the patient is non-compliant or aggressive. And then I'm going to adjust the bed to a proper working height, lowering the rail that's closest to me that I'll be working on. Make sure that the patient is comfortable. And then I'm going to inspect the area that the restraint will be placed on. I'm going to note any tubes or devices that I'll want to be careful of not to pull or snag. I'm going to assess the patient's skin integrity, sensation, their circulation and perfusion, and full range of motion. Next, first we'll do the belt restraint. That's going to help keep the patient back in bed if they had just had surgery possibly and we're trying to get up and go to the bathroom. We want to keep them safe, so I'm first going to help the patient into a sitting position. I'm going to apply the belt over the patient's clothing, moving along the back first, asking the patient to sit up so I can wiggle the belt along its back properly. I'm going to smooth out any of the wrinkles or bulging in the patient's gown. I'm going to then feed the slots, the attachment like ribbons that are on the restraint through the D slots. And then I'm going to bring the ties through the slots, assisting the patient into a supine position, and then asking the patient, once I have it secured, to take deep breaths to make sure there's no constrictions on the patient's breathing and that it's not too tight. And then I'm going to attach the restraint to the bed frame, and making sure that it's stationary and that the patient will not be able to reach the attachment of the restraint. Then for an extremities restraint, I'm going to wrap the restraint with the soft cushiony side up against the patient's skin, ensuring that it's not too tight. For same thing kind of for the mitt restraint, to make sure they're not picking anything, and that their hands aren't accessible. I'm going to put the hand into the mitt once again, securing it at the wrist, making sure that I'm not at the forearms, and then always making sure that the restraint is not too tight on the patient. Next would be an elbow restraint. So if someone was picking at their IV maybe, I would put the soft cushion padded side of the splint over the patient's elbow joint, making sure that the joint is rigid and not able to move or bend the elbow. Then I'm going to secure the quick clips or attachments to secure the restraint, making sure it's not too tight, and making sure that the edges of the side rail, that I'm not attaching it to the edges of the side rail. I'm going to then make sure that the quick release ties and buckles and seals are adjusted properly. I'm going to double check once again to make sure that the restraints aren't too tight for my patient and there's not causing any pressure or rubbing or friction anywhere. I'm going to remove the restraints at the proper time intervals, at least every 2 hours. And then I'm going to assess the patient every time, assess the placement of the restraint, remove one at a time if we're using multiple restraints on a violent or non-compliant patient, or I will ask for further assistance from another healthcare professional. Um, Lastly, I want to ensure and make sure that the patient knows where their call light is in case I need to come running to them or something is wrong or they have to use the bathroom, and that they know how to use their call light. I'm going to raise the side rails again on the side that I was working on, making sure that the bed is locked and the wheels are in place, and that the bed is lowered back again into the lowest position for patient safety. I'm going to dispose of all my used supplies and equipment, making sure that I'm leaving the patient's room tidy. And then lastly, I'm going to remove and dispose my gloves, perform my hand hygiene once again, and document and report the patient's response or outcomes, document the type of restraint that was used, the time that it was applied, and the reason for restraining the patient.